morning. I'd like to spend a little bit of time today going over the most fantastic gift the Democratic Party has gotten in decades. It's called health care. Let me give the Democratic Party just a little bit of information, or at least some help that I think they can use. A, every piece of correspondence leaving any Democrat, elected Democrat's office, every piece of correspondence needs to have the exact same thing on it. And what's that thing? Health care for all, universal health care. Every Democrat who is in elected office needs to get a stamp put together in the outside of their envelopes, on the front of their correspondence, on their answering machines. They should say, health care for all, Medicare for all. Every time they appear on TV, health care for all, Medicare for all. The bottom line is simply this. Let's take a page out of the playbook of the Republican Party. Most of the time, you'll hear Donald Trump lie, 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 and lie. He continues to lie until the, whatever you'd like to call the 63 million, decide to, oh yeah, must be true because it keeps getting repeated. The same thing needs to be done with the Democratic Party. They need to grasp one single issue and pound the hell out of it until everyone across the country, black, white, pink, green, purple, and polka dots, urban, non-urban, farmland, everybody has to hear the same thing over and over and over again. And what's that? Universal health care for every single, and make sure you add this, American citizen. Never mind, we can play with it later on and include everybody. But as far as the people listening to this ad are concerned, it needs to say American citizen. Let's start appealing to the people that vote, and let's not worry about protecting the people that don't vote until we're in power. It's absolutely absurd that we spend all this time talking about issues for special interest groups that don't vote. So let's use some common sense here. Everyone needs health coverage. Every single human being needs health coverage. For the young people, we talk about health coverage that takes care of their emergencies, whether they break a leg while skiing, whether they break a leg while parachuting, whatever the hell millennials do these days, they need to know they need the coverage. The bottom line is the Democratic Party, along with everyone who gives a damn about health care, needs to use that phrase on a continuous and constant basis. Everything needs to center around health care for all, Medicare for all. Just as I mentioned the other day in a show, health care for all, if President Moron were to get behind it, would give him a damn near get-out-of-jail-free card. I'm fairly confident that Nancy Pelosi, who is House of Representatives, and Chuck Schumer, the Senate, they would be more than willing to, let's just say, maybe forget about some of these Russian investigations if President Trump decided to go along with them. And what do they want? Health care for all. Universal health care. It can be done. It's not that difficult. And the truth of the matter is, it'd save a hell of a lot of money. If you take a look at the entire package of health care for the United States of America, there's numbers floating around that it's 1/5 of the entire economy of the nation. So let's look at that 1/5, how many $1 trillion that is. And then ask yourself a very simple question. If the new health care for all, Medicare for all, costs the exact same thing, how much would we save if we got rid of the corporate profits? Yes, rid of the corporate profits. No longer are CEOs of insurance companies getting $10, $20, $30 million a year to orchestrate how the public is being screwed by their private insurance companies. Think about all of the hundreds of billions of dollars being put into the private bank accounts of people because of the healthcare situation that we have today, i.e. private. Remember, everything you do, every email you send, instead of saying love John or goodbye Samuel or hello Marilyn or whatever the hell however you sign your emails, you need to put at the bottom, go for health care for all. As I said, every envelope, every piece of correspondence, every answering machine, every phone, Everything you do needs to have that clip on it until we get to a point where all of the American people think, you know what, that's a pretty damn good idea. Now, again, I'm not suggesting that we eliminate private health insurance. Absolutely not. If Blue Cross, Blue Shield, Aetna, or whatever want to continue to sell private health insurance, be my guest. Compete with the private industry. Some of you may be aware of the fact that in Switzerland, a country that you would have to agree is based on business and buckaroonies, in Switzerland, the federal government for Switzerland decided many years ago that they needed to put together a program to bring health costs down and give a broader coverage to all of its people. So what did they do? The government itself came out with a program or health care for all, and they priced it. Well, guess what? The price was a hell of a lot less than all of the private insurers. What happened? After about 4 years or 5 years, I honestly don't remember exactly, the private healthcare industry decided, maybe we'll take a little less profit, and they reduced their premiums. And they continued to reduce their premiums until, guess what? They were less expensive than the government-operated plan. So what happened? The government said, okay, it's all yours. Now it's private, but they're keeping an eye on the price. And that's exactly what could happen here. I have absolutely no problem with Warren Buffett if he'd like to have private health insurance, if he'd like to have a concierge doctor where he could pick up the phone and call that doctor and say, hey, doc, I got a pain in my butt. Come see me. And the doctor jumps over, comes over the fence, goes and walks up to Warren Buffett's house and says, hey, I'm going to take care of the pain in your butt. That's okay with me. I have no problem with that. However, there's 350 million people out there that aren't Warren Buffett. And those 350 million people need health coverage. It can be done, and it can be done fairly, and it can be done progressively. And what do I mean by progressive? It's very simple. When a person files their income tax, let me go over this very slowly. A person files their income tax. In return for that filing, they are given a card. The card designates what their gross income is after tax deductions. And that amount of money is what is going to be determined as to what copays or deductibles the person has. Example only. Someone making $25,000 a year or less would have zero copay, zero deductibles. Maybe someone making $25,000 to $50,000, maybe they'd have a $5 copay and a $50 deductible. Continuing on, when you get up to someone making $100,000 or $200,000 or $300,000, the deductibles and copays would progressively increase to a point where if someone were making $250,000 to $300,000 a year, they can sure as hell afford a $25 or $50 copay and deductible. Take those into consideration, and also take into consideration that that little card that they get once a year, because it changes based on their income, that little card automatically, when put into the computer system by their doctor or their hospital or their pharmacy, automatically transfers the funds from the federal government into the doctor's hands, into the hospital's hands, or into the pharmacy's hands. No more billing for any of these healthcare institutions. Yes, it's going to put a few people out of work. However, let's remember, the federal government is going to need employees to run the system. So what do? It's simple. We turn around and we do a list, and the list says there are X thousand people now working for private health insurance companies. We need to hire X amount to deal with the federal program. The rest we will pay, again, an example, 65% of their gross income tax-free for 12 months. Then 50% of their gross income for another 12 months, and so on. So they have time to be retrained and find new jobs, and they're not left out in the cold as the coal miners supposedly are. All 70,000 in the entire United States of America. Don't get me started on the fantasy of all the millions of people losing their jobs over coal. That's bullshit. There's a total of 70,000 people in the entire coal industry in the entire nation. No offense to the 70,000, but they're dealing with the same situation that blacksmiths dealt with when cars came about. It's time to either retrain them, re-educate them, and do both. And if they can't, if they're too old to be retrained and re-educated, damn it, give them the money they deserve for spending 30, 40, 50 years in the goddamn mines. That's really the way it should be. And anybody with the slightest concern for humanity would agree. Now, before I finish this concept, let me just mention the Republican Party. There absolutely must be some members of the Republican Party, certainly not Mitch McGinless, but certainly not the Ted Cruz morons of the day. But there's got to be people in the Republican Party that understand a couple of things. A, they understand humanity. Hello, humanity. You run around screaming about how pro-life you are, unless some poor son of a bitch gets sick and then you say, fuck him, let him die. It doesn't sound very pro-life to me. It's about as hypocritical as saying, I'm pro-life, put that son of a bitch into the death penalty, into prison. Another little bit of hypocrisy. There's got to be Republicans. There must be some Republicans out there that are truly pro-life. And if you're pro-life, shit, man, you need to give everybody health coverage. If you're pro-life, you want to see them alive, not dead. You don't want to see millions uninsured. You don't want to see millions of people dying for lack of health insurance. You're fucking pro-life. Well, act like you're pro-life. And let's all get behind this. President Trump, I said it to you yesterday. This is a get-out-of-jail-free card. Get with Nancy. Get with Chuck. Get with, yeah, I hate to say it, McChinless, and get with Ryan the hypocrite. The five of you sit your asses down, decide on a Medicare for all, and finish this and show the world, not only the United States, but the world, that you really do give a shit about the lives of your own people. That's it for today. I hope you enjoyed the show. I hope you signed up for the show. I hope you told your neighbors and your friends to sign up for the show. And until the next time, bye-bye.